last minute for this. Okay. Hi, my name is Monica. I'm a nurse practitioner student, and I'm here to do your HEANT respiratory and cardiac assessment today. So I'm going to start by examining your scalp, and I'm going to just palpate the scalp, make sure there are no lumps or bumps. I don't feel any. So next I'm going to just assess your face, make sure it's symmetrical. I don't see any scars or lesions. And now I'm going to palpate for your temporal pulses. Okay, I feel them, they are present. Now I'm gonna ask you to just make a few faces for me. Can you raise your eyebrows? Close your eyes really tight. Give me a big smile. Now frown for me and puff out your cheeks. Perfect. Now I'm gonna just palpate for your TMJ. I'm gonna ask you to just open and close your jaw a couple of times for me. Good. I'm feeling for any pops or clicks, and I don't feel any. Okay, so now I'm gonna just use this cotton ball. I'm gonna have you close your eyes. I'm gonna test your facial sensation. When you feel the cotton ball on your face, just say now.
Now, now, now.
Perfect. Okay, so moving on to your eyes now. I'm gonna just look at the outer structure of the eyes. Assessing for any symmetry. It's symmetrical. And I'm gonna just look at your sclera and conjunctiva. I'm gonna pull down your eyelids. They are pale and pink color, normal color looking. I'm gonna have you look up. Good. Look down, side to side for me. Good. Okay. Everything looks good. Now I'm just gonna test for accommodation, convergence, and EOM. I'm gonna have you just follow my finger. Right now I am tracking the eye. I see very good tracking. Checking for any nystagmus. Good. And perfect. So now I'm gonna look at the inner structures of your eye, and I'm gonna dim the light. Hey Google, dim the lights. Or can we just turn it on? Okay.
Doing 2 lights.
So I'm gonna check for consensual light reflex. I'm gonna just have you look straight ahead, and I'm gonna shine this light in your eye twice on each side, okay? And you just look straight ahead for me. So looking for that pupils are reactive, and I'm gonna check the other side, and it's reactive as well. Okay, now I'm gonna do this side. Okay, pupils are reactive, and then checking the other side. Okay, very good. So now I'm gonna look at the inner structures of your eye, behind your eyes. I'm looking for the blood vessels, the macula, red light reflex, and the disc, okay? I'm gonna have you just continue to look straight ahead. I'm gonna just open your eye with my hands here. And I'm gonna shine the light in your eye, okay? You just keep looking straight ahead. Looking for red light reflex, I see it. And I'm gonna move medial, looking for the fovea and macula. Okay, now I'm gonna do the same thing on the other eye, okay? Do you need a minute?
No, okay.
Okay, so same thing, I'm gonna open your eyes. Okay, I see the red light reflex. I'm gonna move. And I see this in the cup. And then I'm looking for the fovea and the macula. Okay, very good. Okay, that's the eye exam. Now we're gonna move on to the ears, okay? I'm gonna start by palpating the ears. Just feeling on the outside, do you feel any pain, discomfort, or tenderness?
No.
Okay, good. Now we're gonna just do the whisper test. I'm gonna say 3 words, and you just repeat after me, okay?
Red, blue, white.
Okay, good. And now we're gonna do the other side.
Cat, dog, mouse.
Okay, perfect. So now I'm gonna look at the inner structure of your ear. I'm going to pull the pinna back, out, and up. We're looking at the ears. Looking at the canal. The TM is pearly and gray. Okay. Don't see any discharge. Okay, same thing here. Pinna back, out, and up. Looking at for the tympanic membrane. Okay. TM is pearly and gray. Okay, so next I'm gonna assess your ears. Your nose, sorry. I'm gonna just look at the nose. I don't see any deviated septum. Everything looks normal. I don't see scars or any lesions. I'm gonna have you just do the sniff test. Cover one nostril and just sniff in. Okay, we're checking for patency. Now do the other side for me. Okay, very good. Now I'm gonna look inside your nose. Looking for pink turbinate. It looks good. Now the other nostril. I see pink turbinate. Very good. Okay, now moving on to your mouth. I'm just gonna use this tongue blade to assess your mouth, okay? I'm gonna assess the lips first. Good. Now can you open your mouth? I'm just gonna check for the gums, the teeth. Okay, underneath here, gums look good. Now I'm gonna check for the buccal mucosa on the side. Perfect. I'm gonna have you just stick your tongue out for me. Lift your tongue up for me, looking underneath. Perfect. And then I'm gonna look at the back of your throat, and then I'm gonna just check your gag reflex. Okay, great. Awesome. Okay, so now I'm just gonna assess your lymph nodes, okay? I'm gonna just start by palpating them, starting with the preauricular lymph nodes, moving back to the postauricular lymph nodes, to the occipital lymph nodes, moving back forward to the posterior cervical lymph nodes, palpating for any nodules. Now I'm going to move up to the submental nodules. Submandibular lymph nodes to the submental lymph nodes, and moving back to the anterior cervical lymph nodes, and then down to the supraclavicular lymph nodes. Okay, I don't feel any nodules there. And now I'm going to assess your thyroid. I'm going to start by just looking at the outer structures of the thyroid. I don't see any goiter, I don't see any mass. And then now we're going to assess the thyroid. I'm going to have you just take a sip of water and just hold the water in your mouth, and then I'll tell you when to swallow, okay? So I'm going to step back. I'm going to look for a ridge here to palpate for the thyroid. Okay, I feel it. Then I'm gonna go lateral. I'm gonna have you tilt your head forward and to one side, and then swallow. Okay, good. I didn't feel any nodules. And then I'm gonna have you take another sip of water. And just keep it in your mouth until I tell you so. Gonna feel for the ridge again. I feel it, and I'm gonna go lateral. Do the same thing forward. And then I'm going to tilt your head to one side and then swallow for me. Okay, the thyroid is there and present. Okay, very good. Now I'm going to just have you shrug and resist against my hand. Perfect. Okay, so now we're going to move on to respiratory assessment. I am going to first just examine, inspect for any lesions. I don't see any lesions. Trachea is not deviated. It's in normal position. I am going to now percuss your lungs and make sure I don't feel for any consolidation. Okay. Now I'm going to do the same thing to your back. Okay. Okay, so now I'm gonna just listen to your lung. You just breathe in when you hear, when you feel the movement of the stethoscope. Okay, breathe. Deep breath. Okay, I'm gonna do the same thing in the back. Deep breath, right? Okay, your lung sounds clear. So now we're going to move on to the cardiac assessment. I am going to just look at the outer structures of your heart and have you lean forward for me. And then just breathe normal. I'm looking for any pulsations or heaves. I don't see any. So now I'm going to just palpate for the carotid arteries one at a time. So now I'm just gonna listen, okay? With the bell. So I'm gonna have you take a deep breath and hold it until I tell you to let go. Take a deep breath. Okay, you can let go. Same thing on this side, take a deep breath. Now I'm gonna listen to your heart using both the diaphragm and the bell. You can breathe normal. Start with the diaphragm first. So now I'm going to listen with the bell side. Listening in the aortic. Then the pulmonic. Herb's point. Tricuspid. And then the mitral point. Okay, very good. So I'm gonna do the same thing, but have you laying down for me. Okay. Doing the same thing, using the bell and the diaphragm. I'm gonna start with the diaphragm first. At the aortic. Pulmonic. Herb's point. Tricuspid. And then mitral. Okay, now I'm gonna use the bell side. Aortic, pulmonic, Herb's point, tricuspid, and then mitral valve. Okay, that is the end of our assessment.